All right, good afternoon, everyone. I'm going to give folks another minute or two to finish joining, but we appreciate you being here and we'll get started shortly. Hey, everyone, we'll get started in a minute or so. Thanks for joining. All right, we'll get started now. Thanks for joining this HIE admin tool training. My name is Kevin Phillip. I'm joined with my colleague Eric Shope, and today I'll be walking through some brief background about the HIE admin tool, and then I'll jump into a demo of the actual stage site so you can get a sense of what it would look like. This training is mostly intended for folks who are actually HIE admins. So if you're not an HIE admin, you are more than welcome to continue to stay and listen, and you can just hear exactly what the responsibilities of an admin are, since they are representing your organization and doing some of these actions for your users. Um, so yeah, I think before I jump into the main presentation, I just want to cover some housekeeping items. So if you have any questions during the session, feel free to drop them um, into the Q&A feature. And Eric will either type back a response to you, or we should have plenty of time at the end to answer questions. I think maybe the material will take me 40 minutes to get through, so another 20 for questions if you have them. But at any time you think of something, you can just drop it in there and we will either save it or answer it. Then are recording this session and we'll send out the recording and the slide deck as well as post it on our socials and our website for later review. Um, and then if you have any further questions, you can always reach out to the Maryland Communication inbox, or you can reach out to myself, Kevin Phillip, or our support line for any additional pieces of information. The other thing I want to ask folks is if they can try to keep the questions that they ask a little bit more general. It would be hard for me to answer on the line something that's specifically going on with your account or your profile. So as general as possible, that could help the rest of the group, I think would be my ask to all of you. Um, all right, so let's get started with what the HA admin tool is, and I'll talk a little bit about what HA admins are first. So HA admins, when an account is set up with CRISP, an organization is sending data and also accessing some CRISP tools. As part of that onboarding process, we like to set up one individual, sometimes multiple individuals, to be HIE administrators to serve the function of managing their users' access. And the reason we do this is because obviously an employee at your organization has a better sense of folks at your organization's job function, what their responsibilities might be, and what appropriate access to CRISP and patient information might be. So we outsource this to HIE administrators to manage, and the way they do that is through the HIE admin tool, which allows administrators to manage user access, access to services, and complete security audits of their users to stay compliant for our perspective. So this is what the tool looks like if you haven't seen it. In the account page. Again, when we go to the demo, we'll walk through all the tabs and stuff, but I just wanted to preface that this is what an admin is and this is what the admin tool is. You can find the admin tool in the CRIS portal, and this is the, I guess, landing page of the CRIS portal where you would go in and access any patient information and any other CRIS tool that is offered. Depending on your access, you may have multiple tiles within your dashboard, or you may have just a few. You can see at the bottom screenshot that the HI admin tool will be living in your dashboard as a card or a blue tile in your dashboard. It does not require a patient search for it to show up. I did want to point out that that gear icon next to your dashboard is how you can actually change the order of the cards that are listed there. For whatever reason, if you are just the admin and you just want to come in and quickly get to the admin tool, you can change the order of the blue boxes in your dashboard by clicking that icon and then using the up, down, top, bottom arrows to apply these changes, and they will extend for every time that you log into the CRIS portal. All right, I want to talk a little bit about our security policy and why we have some of the things um, set up the way that we do in terms of our security. So the first thing I want to mention is we do require user audits every quarter. And essentially, this is where the admins go into the admin tool and basically recertify or tell us that their user needs to continue having their access. And this is important for us to ensure that we're confirming with the organization that that users need to continue to maintain their access, and this helps us protect patient information that we are sharing through the tool. One of our main mottos is, only serving data in the minimum amount appropriate at the appropriate time. And so ensuring that your employees are still active in their job roles and still require a certain level of access with CRISP is what this process is all about. The consequences of not verifying your users through this audit process every 90 days is they will move into a suspended status where they will live for another 90 days until they'll fully be deactivated and no longer have access to their account. And so these are the three statuses that we talk about when we are referring to this tool. So active user will have access to log into portal, have access to log into their services. Suspended users live in that limbo state where they can't log in, but still give time for the admins to come and rectify their situation if for some reason they just missed timed when they were auditing that user's account. And then deactivated users are either users that have lapsed the 90 days in suspension, or they are actively deactivated by the admin because they've left your organization. They no longer need access to tools, or there's some other reason why users have been need to be deactivated. Reactivation of these deactivated users only can be done by CRISP staff. So we encourage admins to try to stay as up to date as possible when auditing users, because once they go into the deactivated zone, it does require a phone call or an email to our support staff for them to recertify or reactivate that deactivated account. Okay, so that is the background I wanted to cover, and now without wasting any other time, I do want to jump into the tool. So give me a second, I will change my screen here. And this is going to be the demo site. Here we go. Perfect. So this is our stage portal. So just keep that in mind as I'm going through things. Some things might look a little wonky, or there might be some tabs that you don't have access to that I do just because it's in stage. But I'll try to point out what your view would be like. in terms of using the tool. So this is the portal home screen. So this is where you would actually go and log in. And you'll notice a couple different things about the portal. The main section here is regarding patient search. So if you have clinical access, that's where you do that. If you have access to our care coordination tool, Population Explorer, that's will that appear there. And then the way you actually um, access the admin tools by clicking this blue box at the bottom. I will point out that you might think you have access to a service and it's not showing up here. It might be because some of our services do require a specific patient search to be conducted before they show up. For example, the clinical information service or the In Context app is only designed to show one patient at one time or one patient record at one time. So it does require a patient search before you get there. But the HI admin tool is not one of those tools and does not require a patient search. Before I jump into the admin tool in earnest, I did want to point out if users at your organization don't know this already, they can actually find who their admin is through the portal by clicking this button here, my HA admins. So this is my crisp stage site. So there's multiple. Usually there'll only be one or a few, but this is how they can actually come and see who their admin is. And you can click and get their information. Their email address that way. So if you run a very large organization, it might be something that you want to point out to your users that they can find that information there. You also can send feedback, so send a ticket to Chris support through the send feedback button, or view any updates that might occur to some of our tools that we publish here in the product update tab. All right, so I'll jump into the admin tool itself. So you're going to click that box and then it's going to launch the admin tool in a iframe. And if you want more real estate to look at the tool itself, you can slide this bar over and then you can always reopen that slider. But this is basically your dashboard of all of the applications that you have access to. All right, so this is what the admin tool homepage looks like, and it has a reminder about the audit process on the front and center piece there. If you do need assistance, we have a user guide and then all of our helplines listed in the user guide and help section. Um, One of the things you may not know about CRISP is we are part of a larger organization called CRISP Shared Services, which essentially we partner with other state HIEs to leverage economies of scale to um, uh, produce cost savings for those HIEs, as well as sharing of best practices. So other HIEs also use this tool, and that's why there's multiple lines listed here. If you could please just use the Chris Maryland line, this will ensure that the staff member can look up your information readily available and get you to the right place quickly. Um, but that's why you see these other numbers here, is there are other state partner organizations that also use the same tool. All right, so to go back to the home screen, you can click home, or you can also click this top button here at any time when you're in the account. So I'll go through this tab by tab now just to show you how the tool operates. The first thing I want to talk about is accounts. So this is the accounts that you manage. Most users will just have one single account that they are responsible for, but you might be an admin that has, multiple uh, parent or child organizations that are part of your larger organization that you might be managing. So you might have multiple accounts listed here. This is also the tab where you will come to audit your users at your account. I'm actually going to come back to that and show you right now what it looks like when you click down into an account itself. So when you're in the account, the first page is all about details. So this is what we have on file for your organization. And if you see something that's wrong, please point it out to us and we hopefully can rectify it, because I think some of this is set up at the beginning and we want to ensure that your information is correct. Anyway, so that's the details we have about the accounts. And then over here is where you can actually see the services that you have available to provide to your staff. So this is going to depend on your organization type and the agreements that you have in place with CRISP that determine what tools you have access to give to users. Later in the presentation, I'll talk a little bit more about services and assets. You can think of them kind of interchangeably in terms of the verbiage. But some assets and some services require an admin to set up, and some are kind of um, only available for our CRISP staff to actually provide access to. We do have documentation on which ones are which that I can point out at the end of our training, but just keep that in mind about services. The other cool thing you can do with this service tab here is you can actually provide access to multiple users at one time through this service feature. So for example, if I wanted to give the reports access to all of my users, what I would do is I would click down into that report asset or service, and then click service management. And this will bring me to a screen where I actually can select the users that I want to assign the service to. So first thing I would do is come in and select the users, and then I would confirm my selection, and then those users would be added, given that service, to their portal account. And once you hit confirm, then it will give you a success window, and you can go ahead and close that. But so this is how you um, manage services or bulk add services to users. I will show you another way to add services that goes through the individual user section later on, but I just wanted to point that out since we are here in the accounts looking at services. The next two tabs that you will see are the user tabs. So there's two tabs. There's one for active, there's one for suspended. And this is where you can see your user list for your organization. Um, the other thing that you can do from this window, this account view, is you can export users. And the export will open into an Excel file that will show you the users and their accesses. I'm actually not sure if this is sharing or if I have to hold on one second. I think I only had that window shared. Okay, this is what the export looks like. You can see um, gives information about the user itself and the audit dates that the user was last audited by. All right, close that out. Just want to make sure I'm sharing the right thing here. Okay, so we're back to our tab. And then the other thing you can do from this window is actually do the user audit. Before I click this button, I want to show you something in terms of user audit and another way you can get there. So this is one way you can get there for a single account. But if you actually go to the accounts page and you have multiple accounts that you manage, you can actually click this audit account section, and then you can actually select the accounts that you want to have. In this staging site, I only have access to one account, but essentially the way it would work is this: if you had multiple, you would click this top and it would select all of them if you wanted to audit all the accounts at one time, or you can do it individually by selecting one or going down into the account page and then actually hitting user audit there. So I'm gonna keep going through the audit trail now just to show you how that works. So once you get to this audit account screen, whether it's one account or multiple accounts, what it will do is it will show you the users um, and give you the option to approve or deny their access. You can also click this approve current page button to approve all of the users listed on one page. Um, Keep in mind if you have multiple pages of user, it's only going to do one page at one time, but you can do that for ease of use if you know, for example, that all of the users need to be approved. All right, so you see all of those were selected, and then you can go ahead down to complete audit. This will give you a summary view of the ones that you approved, i.e. want to keep active, and then the ones that you denied, i.e. want to deactivate. And then you can go ahead and finish. Since this is a demo site, okay, it did work. Okay, that's the success thing that we wanted to see. I was going to say it might fail just because of that status. Anyways, then you can click over to your suspended users, and this will show you the users that are in that suspended status, and you can, again, approve or deny their status to complete the audit for those purposes. Pretty straightforward in terms of user audit. We do have a search bar here as well if you want to search for a specific user. Um, but I think generally most folks go down one by one to search for their users. I'm going to go back to the home screen now, see if I check my notes real quick to see if there's anything I missed there. I think we're good um, in terms of accounts. So now let's move on to users. So when you click the users tab, this will show you all the contacts at all of the accounts that you manage. And you're able to click down and see a little bit more information about the specific user. You also have a search function here as well. So let's click down into one user. So this will show you um, the details of the specific user and then allow you to manage their services. Um, so if you wanted to add a service to a single user account, that's how you would do it in clicking that service management piece. You can click assign services, select the one that you want to add to their account. And then continue with the prompts to confirm that as well. Also in the service management is how you would deactivate a service. So this is an example of a situation where, like, let's say, for example, Walker, this contact was doing something with COVID lab tools and they no longer need to do that anymore. You could do a deactivation of a specific service instead of deactivating their full account. Um, and then you can also see their status here. Sorry about this. I'm just checking my notes really quick. See if I missed something. Um, if you, for whatever reason, need to edit a user's last name, their suffix, their salutation, or phone number, you can come into this edit button here. And actually change some of that information. Some of the information, like their account that they belong to, their email address, that is going to be locked down, partially because the email address is what's associated to their login at their account. There can only be one email address per account, one account. So if you ever have a typo in adding users, please reach out to our support staff and they will be able to assist you. Most likely, the remedy that they'll ask you to do is create a new account with the correct email address, and then we can always deactivate the user uh, from your account. Sorry. Um, so the other thing to notice, it's called related here, but on your side, it's actually going to be called user services. It's just a stage asset piece that's incorrect. And then this is also going to be labeled as user services rather than assets. So just keep that in mind. But essentially, what this page is showing you is what services or products that this individual has access to. Um, And so you will see the service and then whether or not it's active. And this part is not necessarily intuitive, but this is also where you can actually reset a user's password if you need to. So what you will do is you would come in here, you would click View All in terms of user services, open this page, and the one that you're looking for is the one that is the product name portal and it only has portal next to it. So this is the one that you're looking for in terms of the asset. And so you would click that. Um, and then click this down arrow to HIE portal user management. And this is where you can reset password. You can also resend an activation link to a user upon their initial setup. So when a user is created, they receive an email to set up their portal account, which stays active for 72 hours. We know in the real world that sometimes you create a user and they're out of office, or you create a user and they're sick, they can't come to work, and they don't get to it. If that 72-hour link has expired, the admins actually have the ability through this process that I just mentioned to come in and resend the activation link here. Again, not very intuitive. I wish it was a little bit more simple. I will walk through the workflow one more time slowly so that you guys can see how to reset passwords and reset activation links. So click on the name of the user that you want to do that for. You would click this tab that is called Service Management on your side or User Services. This would also be labeled as User Services. You would click View All, and then you're searching for the one that has uh, the username, the account name, and then just portal right here. And then from this drop down arrow, you can hit HIE portal user management, and that's where you can hit reset password or reactivate, send a reactivation link. Users also have the ability to reset their password on the home page. However, the reset password link won't work if they've never set up their account before. So if users haven't activated their account in that 72-hour window, they'll require another activation link to do that. If for whatever reason they just forgot their password, they can reset it themselves through that reset password on the portal home screen, or you can do it for them through this workflow. Again, I apologize that it's quite confusing to get there, but that is the way that the tool operates currently. Um, all right. So I'm going to go back to the users tab and just make sure. So we talked about edit, we talked about service management, we talked about related. I was going through my notes, making sure I covered all the things. Um, okay, I think that is all here that I wanted to cover. So now we'll move from the users tab to actually this add users tab. You have two options to add new users. You could do it at a single user level, or you could do it in a multiple user level. So I'll start with the single user level. The first thing it's going to ask you is for the title of their role. This is important because it helps us understand what other information we will need to ask you, as well as what services are potentially available for them to access. So you would click the title. Let's say I'm adding a physician. You would click the organization if you have multiple. If you have one, that's the only one that would show up. User type will always be portal. That's the only option we have. Then you will ask for your um, first name, last name, and email address. Um, and then the department that they work in, and then this is where you add in their license for, and then phone number, and then license number, license type, and then MPI number. So those things will be required to do in terms of um, adding that specific user. Um, And then once you have that information set up, you will either get a successful or a unsuccessful message. It will also ask you to confirm attestation, asking you to acknowledge terms and conditions before continuing on to adding the user. So that is a pretty simple process to add a single user. To add a bulk user, what you will do is you will download this bulk user template, which I'll open up now. And so this just gives you an example of like whatever title you want to add the user, what information is required to fill out. Um, so that is listed here in this required fields, and then this user list is actually what you would fill out. And some of these do have a pick list for you, so you don't have to type in exactly what it is. You can just use the pick list. Essentially, what you would do after that is you would save it and make sure that you save it. I'm actually not going to save it for the demo purposes, but you would save it as a CSV file instead of a Excel workbook. Um, and then you would hit upload the file. You would click that file and then um, click create users at the bottom. So essentially what it do, it will take in the information and put it in a table here. And then once you hit confirm, it will take you to a page that allows you to look at what you have uploaded and will respond with any errors that it found. For example, let's say MPI number was missing for some folks. You will actually have the chance to edit that information in the window itself before continuing on with the creation of the user or users in this case. Um, and let me just see if there's anything else. Yeah, and then that is pretty much it for the admin tool demo. So I'm actually going to go back to my slide deck really quickly and talk a little bit more about services. So I did mention that some services are available for admins to add. Again, it depends on your organization type and what services and agreements you have in place with CRISP. But then another thing would just be some services are available for you to add, and some need to be set up separately with our support staff. So on our HA Admin Tool website, you can actually see a list of those services available for adding in the HA Admin Tool and ones that are available only through the addition of the CRISP staff. Um, Keep in mind that the CRISP staff, when the user asks for one of those accesses that the user can only get through the CRISP staff, they will still probably ask you as the admin to confirm that this access is appropriate for users. Um, so I did want to talk about service name and what kind of entails through adding of the services. So portal is automatically added when you create a user, obviously, because you are literally setting up when you're creating a user this portal account. So you don't have to worry about adding the portal asset. Then there are a couple different other assets that you can add. The send tool, in context, consent, reports, referrals, and social determinants of health, just to name a few. Send is what we call Population Explorer. So that is the care coordination tool within the portal account where folks can see alerts for encounters and other information. In context is the clinical information service, so that ability to search for a patient and pull up their record. Consent tool enables registering for patient consent for sharing of sensitive data. Our reporting tab, this one does require some additional setup in terms of a um, um, access through another tool called Role Manager. So what the admin's responsibility is essentially to add reports, and they themselves may be the admin for CRS, or there might be another individual at your organization who is the CRS admin who has access to the CRS credentialing platform. And that is where they can add granular level of reports. So you can think of when you're adding the reports asset here, you're basically just giving them the tile or the window to look at reports, and then that CRS admin separately goes into Role Manager to add reports asset. It may be yourself, and we do have materials that cover that. I'm not going to cover it here just because it might not be applicable to every admin. I don't want to confuse them. Referral tool. This allows for users to search for CBO programs and send referrals to social need programs. And then social determinants of health screening tool. This this allows for physicians or care managers to add social needs assessments of patients to be shared with the rest of uh, individuals on their care team. Alrighty. I did want to point out too, in our appendix of the slide deck that I'll send out, there are some more slides about these services in particular. I'm not going to cover those today. We do have a separate training that kind of goes through some of the basics of those tools, or even goes into a little bit more detail in terms of demo of some of those tools. If you go to our website, you can find our events page and see what upcoming trainings we have. But you can also find on our YouTube page some of those examples. I did want to open it up for questions. Um, I don't know, Eric, if there is there any patterns that you would call out from what you've answered so far?
No, not patterns, but a good question about what the follow button is for in the audit tool.
Yeah, so I think that might be a staging thing. I'm not sure if it's necessarily present in your tool. It might be. We built this tool on top of a Salesforce um, account management database. And so I think it's just a part of the Salesforce piece. I don't actually think it does anything. So you can almost disregard it. If it is present for you at all, it might just be present for uh, the users who have a stage access like myself. Someone says QR code enabling 2FA. So admins can't reset up the 2FA process for users. I can talk generally about 2FA setup. So, uh, upon getting a portal account, you are required to do two things. You're required to set up a password, which there are specific requirements of the password length, all of that stuff that are shown at the time of setting up on the screen. So that should be a pretty simple, straightforward process. The second piece that's required of users is enabling this two-factor authentication. There are three methods in which you can do two-factor authentication. The first thing that will happen is the portal will ask for your cell phone number, which you can give to it, and it will send you a text message that will give you a link to download an application for 2FA called Authy. So if you get that text message, you click that link, you'll be able to download Authy, and then it will automatically connect to your portal account. For whatever reason you don't want to use Authy, that's totally fine. What will also be shown on the screen is a QR code that allows you to open up any 2FA application of your choice, whether it be Google, Microsoft, Duo, anything that you already are using, and add a new account in that application, and then scan the QR code that is present on your screen. The 2FA application will give you back a six-digit code, which you then put into the box, and then you will have that application connected as your 2FA method. The difference between Authy and then other 2FA methods is Authy we have set up to um, do push notifications. So instead of you just having to enter a code, if you have Wi-Fi and notifications enabled on your phone, you can actually just click a button and then enter into the portal. To use another authenticator app, you do have to type in that six-digit code that changes, I think, every 30 seconds to a minute in your application. And then uh, you'll be able to enter the portal that way. So hopefully that helped answer your QR code enabling 2FA question or comment. If you're having real issues with 2FA, I would reach out to our support staff because it's hard to kind of diagnose without knowing your specific situation. Um, I was late due to an emergency patient in my office. May I know, will you be sending today's meeting how to upload panels and screening tool assessment to our emails? Great question. I will be sending the recording of this session about the admin tool and the slide deck associated to that. The question about uploading panels and screening tool assessments. We do have trainings on our website about those specific features and functions. Um, we didn't cover uploading panels today because sometimes they are different people than the admins, believe it or not, at your organization. And so in a separate session, we can cover that as well as talking about the screening assessment tool. But if you have specific questions now, I'm happy to try to answer them. I'm an admin. Can you let me know how I can activate an on hold or suspended PDMP account of our prescriber? Certainly. So, going back to the demo site, let's go here. Um, Sorry, let me relog in and log me out due to inactivity. Okay, so come back into the admin tool. And so the way you do that is you can actually go to accounts. You can find the account where that user lives. You can hit user audit, and then you can click suspended users. Then you can search for the patient that you or the individual that you want. Um, let's say I'm searching for this one. I can hit prove, complete audit, finish. And then they should get access again to log into their account. Hopefully that helped, Patricia. more question. What if it's saying active as I just audited the account before, but the prescriber couldn't send some scripts? Um, it's a good question. It's possible that it's a user error on the prescriber side. I don't know, Eric, if you have other suggestion of that.
Yeah, I would just have them reach out to the account manager and have them look up that prescriber and see what's going on.
Yeah, I think it's hard to diagnose that. If you're seeing it active on your side, then they should be active and be able to do everything that they should be able to do within CRISP. Sorry, we couldn't better answer that question for you. Cool. Um, all right, we'll stay on the line for another minute or two. How do we validate users to prevent suspension? This is a great question. So, users, when they're added, basically have a timer associated to their account that every 90 days they need to be recertified. I know we have systems in place, such as email notifications that we send to admins telling them what users are nearing the suspension trigger. Um, if you pay attention to those notifications, you can stay on top of it by always auditing your users before the suspension period. The other thing you might do is just on a weekly basis or a bi-weekly basis, maybe come into the tool and just check users that are getting close to that status and that need to be reactivated. As far as like how you should go about validating users at your organization. That is really up to you and your organization on how you want to manage that. If you are an admin who maybe is overwhelmed or needs additional assistance, and you want to bring another staff member to be an admin, you can always have a conversation with our Chris support staff or your account manager, and possibly we can add another user to help you with the admin tool itself, especially if you're not feeling familiar with that person's role at their organization. Um, so it's hard for me to answer the organization specifics of how you and your organization want to answer that. But as far as I would maybe schedule time or look for those email notifications of when users are getting close to suspension to be serve as a trigger for you to come into the tool and perform that audit. Uh, so yeah, I hope that helps. Great question, Amber. I would email support or your account manager, and then we can help you fix that on our side in terms of change of address. That goes with any other pieces of information about your account. If things change, we're always happy to go in and change it or figure out the best solution for that. Thanks, Carol. Appreciate that. How do we find out who the account manager is? Yeah, that's a great question. It's not something that is listed externally places. Our support email address, if you just reach out to support, you can be like, ask them, hey, who's my account owner? Who's my account manager on your side? And the support team can connect you with them. But we do have dedicated account managers on our staff to assist you with your organization. Um, um, Thanks for that question. I would reach out to support and they can tell you that. And account managers can be really helpful to navigate the support world here at Crisp. I would implore you to find out who that person is and establish a relationship with them because they can also help you take back any feedback or suggestions to the rest of our team who builds the tools itself. Could you please show how to add reports to an account? Um, Thanks for the question. So I just want to clarify really quickly that you can't add an asset to an account. You can add assets and services to users under a specific account. I just want to make sure that terminology. I think you were asking about users, but I just wanted to make sure for folks uh, yeah, okay. I just wanted to clarify just in case folks are confused of like how like they think they can add something to an account that they can't. So there are two ways to add services to users. There is a way which you do it through a bulk process, and then there's a way you can do it at the individual user level. I'm going to show you the bulk process first, and then we'll go to the individual user level. So first you would come into the account name where the user lives and then you would click services, and then you click the service that you want to add to that user and or multiple users. So you click down into that, and then on the right side, you'll see the service management piece. This is where you can click into and assign or deactivate that service for multiple users at one time. Um, there's also a search function if you do it this way, so you can actually find that user already. Or you can click through if you don't have that many. But anyways, you would select the users that you want to add the service to, and then come down, hit confirm selections, and then complete, and then you would give that service to that user. The other way you can do it at a single user level is come into this users tab. Again, you can search for that user, or you can actually click down into that user itself. On the right-hand side, there'll be a similar tab to what we just looked at called Service Management, and then you can assign services. The only thing to keep in mind when doing that, you can see the reports are not showing here. It's because this user already has the reports asset. I apologize for this being confusing. It's going to say user services not related on your end. So this is where you would click to actually see, and you can see this person already has reports. But let's say they didn't, for example, um, service management, assign services, and clicking the reports tab is actually how you would add it. Um, so those are two ways to add it, one at the bulk level and then one at the individual level. So I hope that helped answer your question. Um, Claudine, thanks for the presentation. Awesome. Yeah, thank you for attending, Claudine. Appreciate it. All right, I'll give one more minute for questions. Barbara asked, can I add services myself? Um, so it would be a similar process to what you just saw, in terms of you just have to find your specific account, to do that. Um, I don't know, Eric, if you have any other thoughts, but I think that is the same process. You just like have to treat yourself like an external user in that sense. Find your account and then add services. Yeah, the presentation will be sent out. Do we need to sign an HIE agreement whenever we add new users? No. So the agreements that you sign with Crisp are at an organizational level. And then when you log into the portal for the first time, there are some terms and conditions that the individual user actually has to click and sign off on. But there's nothing like waiting for a contract or participation agreement or anything that is done at the organizational level that is done when that org is set up. So once your org is set up and you have an HA admin, you have access to this tool, you can set up users and they can log into portal. It'll just be asked to agree to terms and conditions, but there's no other like back and forth contracts that need to be signed, if that's what you mean by agreements, which I think it is. Should I contact the account manager to find out how to get an option available for services for send and in context? Yeah, I would reach out to them. Appreciate the question. Alrighty, well, thank you all for attending today. I hope that this has been helpful. Again, if you have any further questions, you can reach out to our support line, and we will send the recording and slide deck out to you shortly. Thanks all, and have a great rest of your day.